Здравейте отново.
Good morning again. I'm glad to see you all back in for the second panel entitled Assessments and Analyses. And in order to make it more exciting, we will start with a transition to the beneficiaries of the ZOV program. At the beginning of this panel, I'd like to invite Ms. Kotseva, the long-term director of the kindergarten in Montana called Prolet Springtime, and Nora, the mother of Ivailo and Georgi. Please come forward. And the current director, Ms. Stoyanova. Ms. Kotseva, I suppose you have a lot to say about interaction with children. But first, introduce those two guys. Good morning, everyone. My contribution to this neighborhood continued for 27 years. And my desire was to build a new kindergarten. And thanks to the Bulgarian-Swiss project, I can enjoy this wonderful infrastructure which I'm handing down to my new replacement. And these people attended the three facilities. We had the building which was then engulfed by fire. And this is my hero, who managed to benefit from the third infrastructure too, and he received some additional support under the project for Bulgarian language and mathematics. The three facilities were attended by those parents who wished their children to make significant progress. We have our health mediator here too, who is our own graduate too. Georgi has his elder brother. He has a diploma for excellent performance in grade 3, whereas Ivo holds his first diploma for excellent graduation of grade 1, and Nora, her mother, she was very young when her husband passed on, and she was left to care for her children on her own, and she's now employed full-time. The conditions that we have now are brilliant compared to what we have been through. This is everything we've dreamed for, because this is what our children deserve. And so I call these children mine because I spent 27 years there, but I also work in 2 other facilities, into other locations, and thanks to other projects they were refurbished too. And it was wonderful that at the end of my career I was able to witness these achievements, and I hope you to be as happy as I am now to see your dreams come true. I would like to express my gratitude to this project for having the honor to be employed and to work with these wonderful people. I want to thank the project for helping my children to be now excellent students and to make me feel proud as a mother. Thank you very much indeed. As you heard, I've been appointed a director for 2 months only, but I'm very proud of working in the most beautiful kindergarten in Montana, and now we have a lot of children wishing to attend our kindergarten because it's a great place to be indeed. I'd like to thank you. And now you can, I don't want to make these children feel self-conscious at the stage, on the stage, but you can talk to them later if you like. It is very important to see the external viewpoint on a program, and we look forward to the presentation that will be delivered by Professor Dr. Ilona Tomova, who is an evaluator for the ZOV program. The floor is yours. Thank you. External evaluation was carried out by a Swiss agency led by Harold Meyer and Michael Morlock, with the support from two officials from the Swiss government. This is a program that was in the focus of the Swiss government throughout. During the first stage, we had Laurent Yedin, etc., and two Bulgarian officials, Eva Boneva and myself. Our main goal was to assess performance and the long-term effect. What changes in children and in parents and in the communities were achieved as a result of the project. See the good practices and the lessons learned, as well as the threats and challenges in order to overcome them along the run, and give recommendations for a second Swiss contribution for encouragement of social inclusion. We use the traditional evaluation methodology: document assessment, online survey, structured interviews of the local government and school principals, NGOs, doctors, media, health mediators, education mediators, and beneficiaries such as the Roma benefiting from the project. You can see here the outcomes that we identified by municipality. We didn't visit Russe. This is why we have the blank space, because a specific requirement for assessment of the positive educational results in their linguistic skills, cognitive skills, motor skills, social skills, required evidence collection through two independent sources. And if you're not on the field, you're not able to do this. In Sliven, because the infrastructure project took longer, the services had only barely started when we visited the site. So this is why their performance is poorer compared to the others. What is sustainable, and what we haven't specified in this table, is the change in attitude and the change in trust of the local governments, as well as of the people from the most marginalized communities to the authorities. You know that this trust was destroyed to such an extent that sometimes when we have life-saving situations, people become very aggressive. But in the municipalities where the project was implemented, this was overcome, and this was really visible. The progress of these kids is amazing. Didn't mention that these kids are excellent students in mixed schools, not in the schools in the neighborhood. And when you approach the parents of these kids, a major effect is that parents and children have dreams. They want to have a career. They aspire of becoming good professionals, and this is something that we couldn't see, we couldn't observe 10 years before. And they now, if in the past parents wanted their children to get married and have a family, now they are after good jobs and well-being. We have major changes in attitudes and behavior, including family planning. Early marriages are a norm in the neighborhood, and until a woman delivers a boy, they continue having children because this is their obligation. So mediators and educational mediators and teachers worked day in, day out to change this attitude, and this is visible. When we assessed the major aspects of the projects, we realized that the project's relevance was assessed with a top score. The services provided under the project to a great extent correspond to the priorities and needs of the beneficiaries and meet the goals of the National Strategy for Roma Integration. At an early stage, certain activities dropped out with respect to Roma empowerment was seen as a missed opportunity. Good results were reported with respect to the effects of all these activities, refurbishment or construction of infrastructure. In the field of education or health services, the educators and medics included in the project. All this is brilliant, and the goals set in advance were met. However, in the course of project preparation, no target indicators were set as a result of the activities. So what the target was and how they can be measured. So this is something to be overcome. Such indicators should be set at the beginning, and more attention should be spent on project preparation so that monitoring can be and management could be more focused and to the point on what we want to achieve once the services are offered. Effectiveness received the poorest score because of the need for project preparation and change in the project design in all the municipalities that were assessed. The project was delayed by 2.5 years, and then in half of the municipalities there was a subsequent delay at each stage with the infrastructure projects. This took attention away from the services to the infrastructure. So there was the soft measures on education and healthcare were delayed even further. The team of evaluators has had its doubts on the effectiveness of some of the projects, especially those related to healthcare, and where migration had reduced the population and the service users considerably. In certain cases, some of the key indicators set were not achieved, especially with respect to healthcare. Irina and Lily had worked extremely hard on systemic observation of each phase of the project development in each municipality, and they had managed to transfer their skills to the local government, which is a major benefit and advantage for this project. But the fact that at the beginning the expected impact had not been planned for at the start of the project was an obstacle for more thorough assessment and for making the managerial decisions to overcome obstacles. Sustainability, as mentioned earlier, had been planned for, and there is good result, generally speaking, with the exception of healthcare services. Challenges, I mentioned some of them, but out of courtesy I didn't put it in writing, but I'd like to share with you the political will for implementing such projects. Given the media and political discourse that we witness in Bulgaria, with the type of communication that we have, in which each incident of aggression or misunderstanding makes political parties to mobilize immediately and start demolishing houses in which the Roma are seen as a threat. It's very difficult to produce tangible results in social inclusion. For almost 30 years now, we failed to focus on this major proportion of the Bulgarian population, and which is now living in very poor conditions, without employment, excluded from almost all social spheres. Mistrust for the institution and mistrust between the communities grew, but this project indicated that these fears and threats and bias can be overcome, and this is something that we should continue to work on. What the ZOV project achieved to enter the most scary ghettos and show good results is a considerable success for this project, and I thank the Swiss government and the Swiss people, but also the PMU, for this accomplishment. The truth is that we all feared that this may be a failure, and we would be used as the scapegoat, and this will be seen as an obstacle to integration, but this was not the case. Our major recommendations with this consider the the fact that this delay resulted in a delay in the local government, which failed to understand the real issues, the real problems. They were not able to give the exact indicators because they didn't know the essence of this minority. And if the Swiss government decides to lend support to the Roma community, it should continue working with those municipalities that worked so well under the first project, but only if when the agreements are made, they indicate that the social integration initiative continues to be a major priority of the administration and of the local community. This means that they should have already considered the pragmatic interventions for social inclusion, that they have the big picture, that they are able to set indicators as the baseline and the targets of what we want to achieve in several years' time. Maybe not all municipalities will be able to benefit from a second project, so this preparation in the process of negotiation is essential. And the evaluators recommended that the focus should continue to be placed on education and healthcare. But speaking of education, we should consider, and it was mentioned by the previous speakers, on the one hand, the emphasis should be placed on quality of education product as well. On the other hand, it is essential to make the transition to employment and employability. That is, the focus should be shifted to professional and vocational education and training and secondary education and lifelong learning. The Swiss experience will prove helpful in that regard too. You know that the Domino project has successfully been implemented. Its strengths can be replicated in municipalities as well. In any case, activities that reduce the risks for employability when we consider extension to the project, and this concerns local changes, but also changes at the central level. So measures and policies targeting the most vulnerable groups, communication, social interaction, and making clear what we need, what we should do in order to achieve certain effects. Because speaking about educational outcomes of the project of the ZOV program, and when we reported that we have many children brought back to school as a result of the efforts of educators, teachers, and the dropout rate has been reduced. At the same time, however, when we visited several municipalities, we had people from the municipality to impose fines on the parents whose children did not go to school. So if we think that in families whose annual income is below 20 euro, and we will increase their educational results by taking away their last penny, we can't let this happen. We can't expect any change. And the government of Bulgaria should commit itself to social integration at the central level. Professor Tomova, thank you very much. thank you too. I can't cover every single topic of our work. Thank you very much indeed for this intervention.
And now I would like to underline the importance of the family planning topic. And now Dr. Radosveta Stamenkova will join us here. She is the Executive Director of the Bulgarian Association on Family Planning. Good morning, colleagues. We know one another, or with a big part of you, we are well known. We work together. We worked in the field. We talk serious business. We also had a great time together. I do love the ZOV program, and I'm going to explain why. Well, in the area of healthcare, it supports two extremely important policies. One, and this is my first love, so to say, the health mediators. This is the most meaningful thing that has happened in the area of the improvement of the healthcare of vulnerable communities. And the other is family planning. There's a joke about a person who went to the Louvre in Paris and saw everything in half an hour. Where there are such people. And now I'm going to explain family planning for dummies. This is a definition taken from our video film dedicated to family planning called The Spiral. It was developed with the support of one of the partners under this project. It says family planning is to have as many children as you want and have these children be born when you want. Family planning is responsibility towards the children. So that's all. We divide this into two areas. One is activities to assist and prevent infertility, and the other is contraception. These are the two big areas. And most importantly, remember that it is based on three main principles: information, selection without force, that is informed choice, and use of best medical practices and the achievements of high technologies. A little bit of background information. We don't think that family planning in Bulgaria has started with ZOV or with our association. No. In the 90s, in Bulgaria, there was the FAR family planning program, which was implemented by the Ministry of Healthcare. At that time, you, however, were not probably even born. But that's history. The partners are the Population Fund of the United Nations and some NGOs. Under this project, contraceptives were provided. IVQs and IUDs and other devices. Also various equipment in terms of family planning. But after the end of this project, there was no sustainability observed. We, from our association, founded in '92, and we were preceded by another organization. And now, the beginning of the 21st century, the Global Fund and the UN Population Fund provided condoms for AIDS and HIV prevention. And the Ministry of Healthcare started work on national program for family planning and sexual and reproductive health. What we do, we provide family planning services locally and also IUDs. Through various partners and programs. We have even provided IUDs to the Ministry of Healthcare and the regional health inspectorates. Family planning and sexual and reproductive health have been part of various donorship programs, the ZOV program, the Norwegian facility, but there is no national program on sexual and reproductive health and family planning. And contraception is not part of the health insurance package. And medical universities do not really provide information or training on contraceptive counseling. And so for me, and the importance of ZOV program, with the supportive supervision, it was not just monitoring program or a controller or an assessor. No, they were supportive, they assisted, and these two people, Irina and Lily and few more, used tailored approach. They were flexible, they were learning on the go. And whenever things need to be changed, these things changed. And from the very beginning, there was sustainability was taken into consideration. And what I most love was this their advocacy approach on the national level. An important thing that the program achieved, with the help of some expert, knowledgeable people, was an economic analysis of the family planning services. That's all. Thank you. And now Todorov from Global Advisors will tell us more about this economic analysis of family planning costs and services. Thank you. Now that we know how important the family planning services are, that we are aware how important it is to guarantee the sustainability of what has been achieved during the ZOV program, the most important question: how much will this cost to the government if a family planning program is adopted on the national level? We try to develop an analysis of these costs based on the experience of the ZOV program and based on some statistical data in terms of the number of people from vulnerable communities who would take advantage of such services. The goal of the analysis was to analyze the cost efficiency of the family planning services under the ZOV program and compare with the lack of such a strategic approach which we see in settlements where such services under the ZOV programs have not been offered. First, we try to identify the program and non-program factors that affect the provision of family planning services. Another important task was to analyze the weight of these factors and see which were favorable and which were just the opposite obstacles. We developed questionnaires which we sent over to the health mediators, and we are extremely grateful to them and everyone who partook in this process. We received 87 filled-in questionnaires, which means that we covered 40% of all health mediators operating in Bulgaria. The factors that work in favor of the family planning services, well, most important was the good interaction with the health mediators. Another factor, health awareness and information campaigns carried out by these people on the local level. On the other hand, the lack of operational program, lack of motivation, and lack of, or insufficient number of medical experts were the factors identified as obstacles to the introduction of family planning services. Non-program factors, most importantly, the access to education and the high level of education. This was already underlined in previous presentations, because they facilitate and help for the provision of family planning services. Other factors that are obstacles: low level of education, ethnical and cultural specificities, lack of permanent income, low standard of living of the big part of these communities. And these factors that are obstacles to the provision of family planning services were reconfirmed at meetings we conducted in the town of Burgas and in Sliven. We're very grateful to the people from these cities whom I see in this hall today, because these people put lots of effort in all these things happening in reality. Some positive trends. And this is setting personal example or role model, and increased number of women who pay more attention to their health now and go to preventive medical checkups. Statistical data that we used, the report, the full report provides lots of statistical data and information, and you can see it if you're interested. Some information regarding early pregnancies. When we compare program and non-program regions, as we call them, the program regions we chose under the ZOV program were Burgas and Sliven, and the non-program Vidin and Pazarcik. As you see, high rates of early pregnancies, especially in Sliven and Pazarcik, and high share of mothers under 16 years of age. That also applies to the average average age of giving birth to a first child. Early pregnancy is not a definitive indicator of unwanted pregnancy. because that depends on some cultural features of the communities. However, abortions are a clear sign. Some research says that 1/3 of women self-identified as Roma have undergone more than 3 abortions, and 80% of these abortions would have been avoided if there were efficient family planning services in place. And now the cost analysis. In order to determine how much it would cost all this to one consumer, we first identified the type of services that would become part of a family planning package. That would provide modern contraception. There were 3 scenarios that we addressed. You can see the services included in this package. First scenario, the IUDs, 167 Bulgarian levs average per capita, and hormonal contraceptives or male condoms. But providing such family planning services through condoms is the cheapest way. It's true, but it's not necessarily the most efficient one. Other factors that need to be taken into consideration: the fact that IUDs are can be used for much longer period, and that's why we identified this as the most efficient method. Based on this, we calculated the prognostic number of women from vulnerable communities that may need such contraception. We had various restrictions during the analysis because of the lack of reliable statistical data regarding the number of potential of women that would need this. But anyway, our calculations quote about 70,000, but this is just an estimation. We had various restrictions regarding and limitations regarding the analysis. In the future, we need more detailed calculations, and each municipality should do this on its own.
We have redistributed costs during the period of the use of the most efficient use of contraception of 10 years. That is almost 7,000 women could be covered by such a program on an annual basis at a national level. As a result, the annual investment of the government is estimated at 1.67 million levs. This presentation is the last one before the lunch break, and I was asked to be as brief as possible. Let me now focus on the major conclusions. They were already mentioned. On the one hand, absence of well-motivated experts to work locally with the vulnerable groups is a major obstacle to the implementation of similar healthcare services. On the other hand, I emphasize again, and I'd like to thank those people who work locally, the health mediators whose role is crucial because they work in the community, with the community, and they are the ones from the community, and they understand the problems better than anyone else. Programs in reproductive health is a major prerequisite for improving information awareness of the vulnerable groups. And one more thing that was emphasized, good health culture and high educational level. They are essential for understanding the need for family planning services. And some take-home messages. 167 levs a year is the annual investment per user. And this is a small resource that could considerably reduce the level of abortions, maternal death, and child abandonment. The indirect effects include choice given to women, improved education for women, and employability and social inclusion. And a national program for family planning will have a direct effect on reducing the burden on the social and health system. I finish off with a message that was voiced during our meeting in the municipality of Sliven. Prevention is always cheaper than intervention. Thank you very much. Thank you, Mr. Todorov. Now it's time for the second panel discussion. I'd like to invite back to the stage Ms. Radeva, the director of the Center for Educational Integration of Children from Ethnic Minorities, Veselina Tiufekchieva, an expert, state expert for Intelligent Growth Program, Mr. Roberto Marinov from the Ministry of Labor and Social Policy, Temelkova and Snejana Popovska from the Ministry of Health, and Gergana Mitreva from the Central Coordination Unit of the Council of Ministers. I suppose that you have short messages to make this discussion very interesting. Let me start with my first question for Mr. Radeva. As a participant in the working group under the project, the Center for Educational Integration under the ZOV Programme has had an essential role to play with respect to training trainers to work with the vulnerable groups. What is the role of your center from now on? The mics are on. Thank you for this question. First of all, let me proudly say that as head of the working group, one of the first things that we did at the center was to develop the job descriptions and to include the educational mediator as a profession in the identifier in Bulgaria. This must have been a very well-needed occupation, and now we have 200 educational mediators. The role of the center is seen in this regard as well, apart from the other activities that we carry out. Educational mediators should develop and institutionalized as a profession. And as Ms. Sacheva mentioned, it will be there will be training offered in order to facilitate the administration of this profession. So I'm speaking about the future steps. Now we have several projects to work on, including some short trainings for educational mediators. I suppose by in the autumn in 6 regions we're going to have different trainings for under the program Active Inclusion, something that Ms. Sacheva mentioned too. We have a series of trainings planned for and methodology development, which is also important. As different as the structures of our society can be, there should be a certain pool of knowledge that a mediator should develop, and we're going to hold anti-discriminatory campaigns. The project for supporting municipalities in terms of desegregation, educational mediators have a role to play, and we are on the same track with Docho, because he mentioned that teaching facilities work in segregated neighborhoods, but others want to work in desegregated areas. But all this can run in parallel. We can't expect change overnight. We work on a 3-year program funded by the state government, state budget, and there is a allocation for mediators and for work with parents, for exchange of students and parents in order to expand the viewpoint of those people, because some have never left their settlement. So these are the specific measures in implementation of the general policies and programs. I hope that we will continue to work with educational mediators and have activities for better quality education and better access to good education. This is our role as I see it. Thank you. Now let's focus on healthcare. Do you believe the cost analysis that we saw earlier can be helpful for future policy making in your sector? Thank you, colleagues. Good afternoon. After Radosveta Temelkova's presentation, I don't see I can say much. It's very difficult to speak after her, because she, in 5 years, she showed us the background of family planning with the milestones and with the major problems. As you realized, the sexual and reproductive policy is part of the overall activity of the Ministry of Health, and this has been the case for many years. Yes, indeed, sexual and reproductive health program was not further developed as a separate one, but some of the activities found their place in the National Program for Maternal and Child Health, and the analysis that you presented in such a detailed way, and most of the recommendations and findings have been included in the Ministry of Health policy, or they will be taken into account in the future iterations of this program and its update, because the focus of policy making was to enhance the attitude of the young population and enhance the health culture of the young people, which is an integral part of the activities to be covered by family planning. On the other hand, we now pay attention on the development of the healthcare services that will be offered by family counseling and family planning facilities. And from the point of view of the Ministry of Health, this assessment will be taken into account in the future upgrade of the national program. So it's a promise. And one more thing. All these issues have been debated in the working group set up under the ZOV program. This was an important activity, and all the experts worked in a very focused manner in order to achieve this good outcome. Thank you. And now, still in the health realm, the health mediator, Snejana Popovska. Good afternoon. Before I consider your question, on the one hand, we have the activities and the strategies, and the legislative activity is different. It's a different manner. So far, we have not achieved in strengthening the status of the health mediator, but thanks to this to the ZOV program, the Health Act will be amended, and it is now in the National Assembly, and it was adopted at first reading, but of course a lot of work is yet to come, because the Ministry of Health and the Minister of Health will issue an ordinance, but health mediators are overseen by different structures of the Ministry of Health. So we should develop an ordinance, elaborate an ordinance on that, and then we should oversee its execution. Now, Roberto Marinov. The last panel ended with a piece of advice that pressure should be exerted on the local governments. What advice could you give to the municipalities to do their job with respect to integration of the vulnerable groups, given that there are local elections coming? Thank you for these questions. I draw on the discussion in the previous panels. I support Ms. Krsteva and Professor Tomova. There are four things to mention. No matter what we say about Roma integration, everything is valid and true. But the Roma communities are different in themselves. Fourth piece of advice to municipalities to have a longer planning perspective, 3 to 5 years. Two municipalities joined the ZOV program at a later stage. So I'm speaking based on experience gained through the integrated procedures. So municipalities planned for 2 years. I don't know how we can hope for tangible changes in such a short timeline. So better planning at the local level, and we should include the potential of all stakeholders, including the Roma communities themselves. They should not plan based on statistics, but the needs should be assessed, and it should be considered whether the target groups can participate, can join in the interventions, because there are projects planned for and approved, but then the needs of the target groups appear to be completely different, and the already approved projects should be changed, which is not the best way to go. So better coordination. These are complex programs that require smooth coordination at the local level, and the community, the Roma leaders and activists and health mediators, work inspectorates, kindergartens, schools should be assessed, should be brought on board in the course of planning, also in the course of implementation and monitoring of project implementation. Understanding the needs, this is key. It's good if these messages are heard by the municipalities and by those who should be implementing them. So in order to sum up, Ms. Mitreva, the coordinator of many projects, what does the ZOV program mean for you? I'd like to first thank you for the opportunity to be here with you again. I feel a little sad for holding this final event. I hope that we'll continue to communicate well and to continue solving the problems we've identified in the course of project implementation and protect the future programs from the mistakes that we've observed and help them structure their measures better. I am glad that I've had the opportunity to work on this project too, although not from the very beginning, because we are the one in charge of paperwork. So we do the statistic and we don't observe the actual final results. So this was extremely valuable experience for me to see the results coming through, and I find all of this discussion extremely interesting because many issues can be resolved at the programming stage. So feedback is extremely valuable. So teamwork and partnerships at the local level between municipalities, feedback to the ministries, policy issues being resolved, and the working group which was initiated to run the funding allocated for vulnerable groups intervention. Thank you. We are also enthusiastic to resolve problems. I hope to be in contact with you. So you found it pleasant to work with the team from the ZOV program. Thank you. Now, into the future, Ms. Tiufekchieva. How can the ZOV program measures can be upgraded in the beyond 2020? Thank you. A very serious issue. I cannot take the liberty to quote figures, but the priorities will continue to be valid, especially for the European Social Fund. It will cover the current fund, the fund of the European Union on health, the fund for supporting the most vulnerable, the fund for social innovations and employment, and for youth employment. The new development, which will make our job easier as a managing authority, is that the European Social Fund Plus will work more closely thanks to the European semester, an instrument we started 2 years ago, and we will another instrument of 2 years ago, the European pillar of the social rights of the citizens. And with respect to education, this European principle has education and lifelong learning as its first principle. What can we expect beyond 2020 under operational program Science and Growth and Education for Intelligent Growth. Ms. Sacheva mentioned some of the projects. There is currently one with a focus on the vulnerable groups called Project for Support for Success, and this draws on the project called Your Class. So more attention will be paid on the vulnerable groups through the extracurricular activities and interest clubs, and additional training in Bulgarian language. So this is support that, as Manuela mentioned, means that there are many problems with respect to covering all children in the kindergartens. But these are large municipalities, and small municipalities encounter even worse problems. Screening is more difficult, their training of trainers is more difficult, education is a multifaceted activity. So this will continue to be a priority for the next programming period. And as mentioned earlier, career orientation and counseling of representatives from the vulnerable groups related to their development. So there are measures and policies and interventions in place and projects targeting professional, vocational education and training. Such a procedure is underway. We'll start at a regional level, because at a national level coordination should be carried out. So we should bring the procedure to the local level. Ms. Sacheva mentioned the access to higher education for the vulnerable groups, including the new procedures which are going to be launched in a few days, dual-track education, which is an upgrade of the Domino project, and training students in vocational and educational schools in learning by doing, with the allocations provided, and other procedures that you may find interesting will be launched at the beginning of next year, with a focus on the vulnerable groups, because the program has a priority access focused on the vulnerable groups, with a special focus on the Roma. So training pedagogical specialists as a key component in multicultural environment. This procedure has been discussed for some time, and it will continue to such procedures. A procedure for inclusive education, and let me mention that under the latest regulations for the new programming period, inclusive education has a wider scope and a wider definition, and it's a recommendation for the EU at large in the course of the European semester, and in particular for Bulgaria.
Another interesting thing is the European dimension for teaching, and we are going to align with it for the next programming period. We're also trying to implement mentorship for the students, but also for the teachers, because these are new things. And as for inclusive education, this does not mean only students and children from vulnerable groups. No, the parents are also involved. And also the general public as well. We cannot segregate, we cannot divide and expect inclusive outcomes. Thank you very much to all participants. And now I would like to propose a lunch break, because we can always continue discussions in informal environment. After that, we are going to focus on the work with the municipalities. We continue at 2:30.